It is important to first know what kind of skin type you have. For example, if you have oily skin type, it is best to use something that's very lightweight, like a gel-based moisturizer. You may also want to incorporate products that have AHA or BHA, for example. On the other hand, if you have dry, sensitive skin, it would be better to use richer moisturizers that are rich in ceramides and lipids. Lighter weight gel-based moisturizers are better for acne, oily skin type, largely because you do not want any congestion or any trapping. AHA and BHA are very popular ingredients that we utilize, especially in acne or oily skin type. AHA or alpha hydroxy acid is a very big category that encompasses well-known products like glycolic acid, mandelic acid, and lactic acid, for example. On the other hand, the most well-known BHA or beta hydroxy acid would be salicylic acid. Now, AHAs tend to be less deeply penetrating, so they are better for more surface lesions or surface exfoliation. So if you have pigmentary changes or very surface acne, then an AHA will be very useful. On the other hand, a BHA tends to be better for deep cleansing. So using it for acne-prone skin is helpful. It gets deeper into the pores as well. You can also combine the use of both AHA and BHA. For example, you can select a cleanser that may contain BHA like salicylate to deep cleanse the pores, and then follow up with using an AHA that contains glycolic acid to improve the surface texture as well. Eczema skin type, sensitive skin type, and dry skin types are three separate different entities. Basically, they may overlap, but they're actually different by definition. So eczema skin type basically means that there is already a pathological problem in the skin. So a patient with eczema may have itchy, flaky patches, and they might be also genetically predisposed to this condition, and for which then the term we will use would be atopic dermatitis. So patients like that require specific care throughout their lifetime. They require good skincare products. They also require certain medications to treat the inflammation. On the other hand, a person with sensitive skin just means that they may not tolerate changes in skincare products that easily, or the introduction of harsh products, but it may not mean that they have pre-existing red or inflamed skin to begin with. On the other hand, the last entity, which is dry skin type, just means that the skin is basically drier than usual. So using cleansers that may be SLS free, avoiding sort of prolonged hot showers, and using good moisturizers to repair the skin barrier will basically take care of the dry skin type.